Hi, I'm Dr. Adatone Musa,
Hi, I'm Dr. Hussein Musa.
and this is Healing Talks with Kingdom Docs.
All right, today we have a great episode. We're going to talk about what's going on in our healthcare system and what we're doing differently.
Yeah.
And how we provide healthcare, how does that affect healing?
Absolutely. Yeah, the way the traditional paradigm works, you see the doctor has a lot of staff, and the doctor bills the insurance. Usually doctors will have many patients, so it's typically a 5 to 10 minute patient visit.
Wow, that doesn't seem like a lot of time.
No, it doesn't. And in fact, what ends up happening is the doctor ends up seeing maybe 30, 40 patients a day with a total patient panel of 2,000 to 4,000 patients.
Wow, well, 30 patients a day is a lot. Let's just say you're seeing about 20 patients a day. And as a physician, I know that seeing 20 patients a day, that's a lot, especially in pain medicine.
Absolutely. There's a lot of, brain power and mental space needed to speak to each patient, even if it's just 5 minutes.
And I want to give my patient the best. I want to give them the best of me. So I think maybe if it's possible to have a system where you have more time to actually know the patient and speak to their medical problems and just give time to hear what they have to say.
It's really necessary to get more time with the patient, to give them that love and care, especially if they're seeing the doctor and you give them bad news. You don't want to spend a short amount of time and say, well, I'll see you in 6 months.
That sounds a little awful.
It sounds harsh and awful, and it's not to speak badly about the doctors in the system, but it's just something that has been forced.
It's true.
Yeah.
And I remember I've seen many patients, and a lot of times if you're giving patients more time than your schedule allots, it actually comes out of your personal time. But one of the beautiful things about this oath of medicine and being a healer, it's natural to us. So most of your doctors, they're going to give you that extra time. Even if it's time out of their lunch hour or time out of their family time or just time out of their life, they want to give it to you because healthcare, especially being a physician, it's a calling for most of us. And one thing about giving you time to speak to your doctor, it gives us so much information.
So much.
I remember I had a patient, he had chronic back pain, and he has seen many doctors. He's tried different medications, he's had injections, but nothing was working. And he was taking a combination of medications and he kept having side effects. And he told me finally what he was taking, and I realized he was taking 2 different medications that actually had the same effect. So if you put them together, you're gonna have side effects. And one of his biggest complaints was not the pain, but it was the side effects. However, he thought it was his pain symptoms that were making everything worse, making his life worse, making him unable to think. But because I took the extra time, I was able to identify something that could make his life better.
You know, it sounds like this could have been prevented by adequate counseling for the patient. This is a common problem. The patient spends a short time with the doctor. The doctor gives the patient, medical advice and instructions. But honestly, it's just hard to follow for most people in just 5 to 10 minutes. And so that's when the mistakes happen. And they end up taking medication combinations that cause so many complications. So increasing the patient visit, really counseling them, would prevent this from happening.
Yes. And we look forward to sharing with you our ideas on how we can address this issue. But thank you so much for your time, and we look forward to speaking with you next time.
All right, see you later. Visit us at kingdomdocs.com for more information.
Thank you, and God bless.